You walk into your dream residency interview, you think you're prepared, your CV is polished, your handshake is firm, but your heart is absolutely pounding. You know the questions they're about to throw at you are designed to test more than just your clinical knowledge. They're designed to see how you think, how you react, and ultimately, if you're a good fit. What if you freeze? What if you say the wrong thing?
You're listening to Rated RX. Your dose for the day.
Hi, I'm Robbie Abasi. As a clinical pharmacist and a former PGY-1 resident, I've been in that exact chair. And now I've sat on the other side of the table interviewing candidates just like you. I know what residency directors are actually looking for behind the smiles and clipboards. In this video, I'm pulling back the curtain on top of 5 questions you are almost guaranteed to be asked. But I'm not just giving you the questions, I'm going to show you how to frame the perfect, memorable answer for each one. Let's get you ready, not just to survive your interviews, but to absolutely crush them. Before we get into the questions, let me give you the single most powerful tool you can have in this process. Seriously, it's called the STAR method. If you forget everything else in this video, don't forget this acronym: situation, task, action, and result. Nearly every behavioral question is a secret invitation to tell a story, and the STAR method is your script. Here's how it works. Situation. Set the scene. Briefly, what's going on? Give just enough context for the story to make sense. Think like 1 or 2 sentences max. Then there's task. What's your goal? Describe the specific responsibility that you had in that situation. Action. This is the heart of the question. What did you actually do? Detail the steps you took, use strong I statements, and own your contributions. Result. So what happened? Share the outcome. If you can put a number on it, great. And always wrap it up with what you learned about it. This framework turns a basic answer into a story that shows you're competent and self-aware. Keep it in the back of your pocket. All right, let's get to the first question then. Why do they ask it? The interviewers want to hear your professional story. They're looking for the highlights that connect your past experiences to your future goals, and most importantly, to their specific program. How to answer it? Aim for a 90 seconds or 2-minute spiel that covers 3 things: the past, the present, and the future. The past, aka your origin story. Start with a quick line about what sparked your interest in pharmacy. My interest in pharmacy really started when I saw the huge impact the clinical pharmacist had in managing my grandfather's complex medications. Boom. Hooked. The present, aka your key experiences. Now connect that spark to what you've done. Pick 1 or 2 awesome experiences from your rotations or projects that confirmed that you wanted to do residency. Don't just list them, show them what they taught you. For example, during my ambulatory care rotation, working directly with people with diabetes and managing their glucose levels reaffirmed that I wanted to get into ambulatory care to give direct patient care experience. That experience solidified my passion for direct patient care and making those clinical decisions. Now the future. Why are you here? This is where you tie it all together with a bow. State your goal, a PGY-1 residency, and link it directly to them. That's exactly why I'm excited about this program, your strong focus on diabetes care and management, and the opportunity for a teaching certificate lines up perfectly with my goals of becoming a well-rounded clinical specialist. This structure tells a story that sticks. Here's what drives me, here's what I've done about it, and here's why I belong with you. Question 2 that you're probably going to see: why are you interested in our program? This might be the most important question you get. It's the one that separates the serious candidates from those who are just blasting out applications. A generic answer here is a massive red flag. Why they ask it? Residency programs are looking for a mutual fit. They pour a ton of time and resources onto you, and they want to know you chose them for real, specific reasons. Not just because the location is convenient, they want to see genuine excitement in their program. How to answer it? Your answer has to be specific and tailored. You've got to prove you did your homework. Mention a specific feature. Start with something concrete about the program that you genuinely think is cool. A unique rotation, a well-rounded preceptor, a research project. For example, you could say, I was immediately drawn to your program because of the dedicated ambulatory care rotation that focuses on underserved populations. My goal is to work in a setting that addresses health disparities, and their experience seems incredible. Then connect it to your goals. This fits perfectly with my long-term goal of doing a PGY-2 in ambulatory care and one day practicing in a federally qualified health center. Boom. If you can, mention the people. If you talk to current or former residents, name drop them, show them initiative. When I spoke to Dr. Jane Doe at the mid-year showcase, she mentioned how collaborative and supportive the environment is, which is exactly the kind of team I work best in. Show them you're going to give back. Briefly mention how you'd contribute. With my experience developing patient education materials in Spanish, I think I could really contribute to the clinic's outreach while learning from your team. A great answer proves you don't just want a residency, you want this residency. All right, question number 3, the dreaded behavioral question. Tell me about a time you had a conflict with a colleague or a preceptor. Okay, let's take a breath. Everyone hates this question, but it's actually a good opportunity. Pharmacy is all about doing teamwork, and conflict is going to happen. This question isn't about exposing your flaws. It's about showcasing your maturity, problem-solving skills, and professionalism. They want to know how you handle disagreements. Do you get defensive? Do you just avoid it? Or do you handle them with respect and keep the focus on the patient, which is ultimately what they want? How to answer it? Well, this is prime time for the STAR method, the one that we mentioned earlier in this video. So first we have situation. Be direct and don't blame anyone. During my internal resident rotation, my preceptor and I had different opinions on the best anticoagulation plan for a patient with a high risk of bleeding. Task. State your goal, which should always be patient-focused. My job as a student was to present an evidence-based recommendation, and I felt I was doing my duty to make sure we chose the safest possible option for our patient. Action. Describe the professional steps that you took. First, I listened to understand my preceptor's point of view. Then I asked if we could talk about it privately for a moment. I brought up the most recent guideline updates and a key clinical trial that supported using a different drug with a lower bleeding risk for this type of patient. I framed it not as a disagreement, but as a chance for us to review the latest evidence together. Then result. End on a positive, reflective note. My preceptor appreciated the research, and after we looked at the data, we decided to switch to the alternative. The patient was discharged safely with no complications. That experience taught me how to advocate for my clinical judgment respectively while keeping the team dynamic strong. This answer shows you're not a troublemaker. You're a proactive clinician who values collaboration. All right, question 4, the accountability question. Describe a significant clinical mistake that you made and what you learned from it. This is the other question that makes your blood run cold. But listen, admitting a mistake doesn't make you look incompetent. It actually makes you look human, humble, and teachable. The real red flag is pretending you've never made one. We've all been there. We've all done that. Residency is all about learning, and learning means making mistakes. They need to see that you can own your errors, figure out what went wrong, and learn from them so it doesn't happen again. How to answer it? Use the STAR method, but really lean into the result and the lesson portion. Situation. Be honest. Pick a mistake with limited patient harm that you caught yourself. Early in one of my rotations, I was on autopilot during a busy afternoon and miscalculated the day supply for an antibiotic. Task. What were you supposed to do? My job was to prepare the prescription accurately for the final pharmacist check. Action. Explain how you owned it immediately. As I was doing my own double check, I caught the error. I immediately set the prescription aside, redid the math correctly, and then went and told my supervising pharmacist about my initial error that I had already fixed. I wanted to be totally transparent about the near miss. Result. This is the most important part. Focus on what you learned and the system you created to prevent it. The correct prescription was dispensed, no harm was done, but more importantly, it completely changed my workflow. I made a new personal rule. I always pause and recalculate for any dose. It taught me that being careful isn't just a skill, it's a consistent practice. This answer screams accountability, a commitment to safety, and the ability to turn a failure into a real improvement. All right, question 5, The clinical scenario. A patient with new onset AFib is admitted. How would you approach their anticoagulation? You most certainly will get a clinical question. It might be a formal case or it might be a spontaneous one like this. They aren't always looking for the right answer, especially since guidelines change. What they're really testing is your thought process. They want to see how you think on your feet. Can you walk them through a problem step by step, gather the right information, come up with a safe, logical plan? Don't just blurt out a random drug name. Walk them through your process out loud, if you can. Assess and gather information. Okay, my first step would be a full patient workup. I'd confirm the new onset of AFib diagnosis and check the patient is hemodynamically stable. Then I'd dig into their chart, past medical history, all their current meds, allergies, baseline labs, paying close attention to kidney and liver function, and any history of bleeding. Use your tools. Next, I calculate their CHADS to VAS score to figure out their stroke risk and their HAS-BLED score to see their bleeding risk. That data is essential to decide if anticoagulation is even the right move. Next, make a recommendation and justify it. Assuming their CHADS to VAS score shows they need anticoagulation, then I think about which agent to start using. Based on current guidelines, a DOAC is usually preferred over warfarin. My choice between something like apixaban or rivaroxaban would depend on the patient's kidney function, potential drug interactions, and ultimately what their insurance is going to cover. Plan for follow-up. Finally, I'd create a monitoring and education plan. That means counseling the patient on why adherence is so important, what signs of bleeding to watch out for, and any follow-up they might need. I document my recommendation clearly in the chart and communicate to the rest of the medical team. This structured approach shows you are a safe, methodical, and thorough clinician, exactly what they want in a resident. All right, a bonus tip, the questions that you must ask them. An interview is a two-way street. At the end, when they ask, so what questions do you have for us? You have to be ready. Saying no, I think you covered everything is a huge missed opportunity that signals a lack of genuine interest. Asking smart questions shows you're engaged and that you're interviewing them too. Your questions should be things you couldn't just find on their website. Here's a few powerful questions you could try. What's the most common challenge new residents face here? And what support does the program offer them to help them overcome it? Another question you could try, how does the program incorporate resident feedback? Can you give me an example of a change that was made based on a resident's suggestion? If you can ask a current resident, what's been the most rewarding rotation you've had? And what's been the most challenging? How are pharmacy residents integrated into the interdisciplinary teams with physicians and nurses on a day-to-day basis? So there you have it. The 5 questions you're virtually guaranteed to see at your pharmacy residency interviews. By understanding why they're asking these questions and using framework like the STAR method, you can stop answering questions and start making real connections. Prepare your stories, do your research, and walk into the room with confidence of knowing you're not just a candidate, you're a future colleague. If this video helped you feel more prepared, do me a favor and hit that thumbs up button and subscribe for more content to help us launch your pharmacy career. Now, I want to hear from you. What's the one interview question you dread most? Drop it in the comments below and let's tackle it as a community. Good luck out there, and I hope you get your dream residency.